Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Wednesday, February 11th, and this is HITshow. Hospitals are adapting to a new reality. Fewer staff, more care outside the hospital, and policy changes that are reshaping access to care. Today we're covering workforce pressure, hospital at home expansion, federal policy updates, and real-world innovation happening inside health systems. Let's get to it. We begin with the workforce. The numbers remain high, and in some regions, shortages are still worsening. Teresa Vaughn is following this story. Teresa?
RHONDA, healthcare is still carrying more than 700,000 open positions nationwide. Shortages are especially severe in rural areas, specialty nursing, and behavioral health. Some hospitals are reducing services simply because they cannot staff them safely. What's changed is the mindset. Executives are no longer planning for a short-term shortage. They're planning for long-term constraints. That's accelerating investment in automation, virtual nursing, and care-at-home models.
Teresa, what are leaders most concerned about right now?
Retention and burnout. Hiring has improved in some markets, but turnover is still offsetting gains. Many systems say workforce stability is still their top operational priority.
Important context. Thank you, Teresa. One of the ways hospitals are responding is by moving care out of the building. Nate Collier has more.
RHONDA hospital at-home programs are expanding rapidly after federal waivers were extended. Programs now include remote monitoring, infusion therapy, and some acute-level services delivered in patients' homes. Executives say this helps manage bed shortages and improves patient satisfaction. Hospitals are redesigning care pathways and staffing models to support distributed care.
Nate, are these still pilot programs?
Increasingly, no. Several large systems now treat hospital at home as a core service line.
That's a major shift. Thanks, Nate. CMS is introducing new incentives aimed at nursing homes and long-term care facilities. Teresa, back to you.
RHONDA, these programs include loan repayment and financial incentives to attract nurses. Hospitals are watching closely. Staffing shortages in skilled nursing facilities directly affect discharge timelines and patient flow. Improving post-acute capacity is one of the fastest ways to relieve hospital congestion.
The workforce issue doesn't stop at the hospital door. Thanks, Teresa. Another federal development hospitals are watching price transparency enforcement. Xavier Banks is tracking that.
RHONDA CMS is continuing to increase enforcement and education around hospital price transparency rules. For executives, the message is clear. Compliance expectations are tightening. Hospitals are being advised to audit files, verify data accuracy, and ensure pricing is accessible and machine-readable.
What's the risk if hospitals fall behind?
Fines, reputational risk, and more complicated payer negotiations.
Understood. Thanks, Xavier. Clinics are reacting to the cancellation of a long-running federal primary care program. Teresa?
Providers say the change creates uncertainty in funding and care coordination. Hospital leaders are watching closely. Instability in primary care often leads to more emergency visits, delayed diagnoses, and higher acuity admissions. Executives say strengthening primary care remains essential to controlling downstream costs.
A national issue with very local consequences. Thanks, Teresa. When we come back, rural workforce investments, innovation inside health systems, and a brief industry update we're sharing as a favor to a friend of the program. Stay with us.
Want to reach hospital C-suites, payer executives, and digital health leaders? HITshow daily delivers healthcare's decision-makers every morning in under 10 minutes. If your solution moves the needle for health systems, let's talk. Visit HIT.show to learn about sponsorship opportunities.
Welcome back. You're listening to HITshow. States are also taking action. Teresa Vaughn has more.
RHONDA, Alabama is directing roughly $200 million in federal funding towards strengthening the rural healthcare workforce. Programs include training pipelines, recruitment incentives, and infrastructure support. Rural hospitals continue to face some of the most severe staffing and financial pressures in the country.
And rural trends often foreshadow national ones. Thanks, Teresa. Innovation continues, even with workforce and financial pressure. Nate Collier reports.
Health systems are investing in technology and care redesign focused on measurable results. Examples include population health platforms helping reduce inpatient utilization and improve care coordination. Executives say the emphasis now is ROI, scalability, and outcomes, not just pilots.
Results over demos. Always good to hear. Thanks, Nate. And a quick industry update we're happy to share. Savvy Cooperative has rebranded as Real Patients. The new name reflects their mission of bringing real-lived patient experience directly into healthcare decision-making. Their focus is on capturing authentic patient voices over time, in their own words, rather than relying only on indirect or incomplete data. We wish Jen Horangeff and the team continued success. Before we go, here's what we're watching. Health systems continue focusing on workforce relief, operational efficiency, and technologies that deploy at scale. We'll continue tracking those developments. Thanks for listening. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare.